Suzanne, and welcome to the GI Health Summit. Thanks so much for being here.
Thank you for having me, AJ. It's really nice to see you again.
Well, same here because I learned so much from you when I lived in Los Angeles, and I'd love you to tell the viewers what it is exactly that you do at UCLA that helps people with various GI issues.
Yeah, well, I'm part of a program that we offer at UCLA. So we have a UCLA Digestive Health and Wellness program, which is really a patient-centered collaborative care program where we have a team approach. And then we look at all aspects of GI health. And what we do is we not only work with symptom management, but we promote health enhancement and personal empowerment for patients. So what the team consists of is the gastroenterologist, whoever you're seeing at UCLA, they manage your medical care. And then we have 3 GI dietitians who are experts in GI health. We also have a GI health psychologist who offers modalities such as gut-directed cognitive behavioral therapy and hypnosis. And then there's me, the integrative health nurse practitioner. And I offer tools and strategies for people that promote resilience, stress reduction, and helping manage GI symptoms. And so all of us use evidence-based treatments. And I think it really helps when people feel like a team is invested in their care and we all work to support the best outcomes for patients.
So how does the stress reduction techniques that you teach, and first of all, I'd like you to name what some of them are, help somebody, say, with diarrhea or constipation or IBS? Because, a lot of people are saying, well, I need medication. That's not, I don't do any kind of therapy like that.
Well, sometimes people do need medication, right? And that's why a team approach is really helpful because we all assess in our own expertise. So the doctor works with the medical care and they'll assess and talk with the patients about medications, get tests to try to help figure out what's going on. And then my role, like I said, is to offer tools and strategies. And so some of the things that I use are, one of the things is diaphragmatic breathing. And how this can be helpful is there's a lot of research that shows it does help GI symptoms. So there's research that shows that it's beneficial for bloating and distension. It's helpful for GERD. It can be helpful for constipation, especially people who have a difficulty letting go of the stool. It can be helpful for diarrhea, and it can just be helpful for overall regulating our nervous system. And so what's great about diaphragmatic breathing is that when we breathe from our diaphragm, it acts as a natural anti-reflux barrier. That's how it can help against GERD. And it also can help with bloating and distension because some of these symptoms happen after people eat, okay? And you need to so diaphragmatic breathing, what it does is it immediately allows you to access your parasympathetic nervous system. Okay. And that nervous system, right? We know fight, flight, freeze, sympathetic. We all know that really well. The parasympathetic is known as rest and digest. And so we need to be in that system to properly digest our food. So doing this breathing, first of all, can help put us in that system and prime our system because that's what we need to be in to receive food and have proper nourishment, motility, and digestion. But it can also be used for after, if you have symptoms that are caused by eating. If you breathe before and then you breathe after meals, what that can do is it can help with gastric accommodation because gastric accommodation is vagal mediated. So when you're stimulating that vagus nerve, it helps promote that. Also, we know that certain people have an increased gastrocolonic response, which means that, when you put something in your system, it can cause your colon to contract more so, right? And sometimes that can lead to a feeling of diarrhea, having to go to the bathroom, the urgency feeling. And that urgency feeling can really cause the stress response to be activated, right? So what you can do is when you do the breathing, that helps modulate the stress response. So it's a tool not only that you can practice regularly, right? We need to train to get to know how to do it and do it enough so that it arises spontaneously when we need it, like in the setting of the stress response or in the setting of when the symptoms happen, right? Because these are not comfortable symptoms. And so we can take the breaths, we can modulate, we can come back to balance with the breathing.
That's amazing. It's something that is that simple. And you did a wonderful video that we'll link to where you actually teach people how to do the diaphragmatic breathing.
Yeah, and I just want to mention that. So when people come to see me in the office, after I assess, how their symptoms are impacting their life, I also want to look at what they're doing to, already to promote their health and build on those strengths. But then after we practice these things in the office. So I teach people how to do the breathing, and then we practice together so they can actually feel the benefits. And then when they feel the benefits, they associate that feeling with doing it. So that motivates them to continue doing it at home. And then when it actually, becomes more of a skill, then that's when you remember and you can use it when you're feeling stress, when your symptoms are arising. So it's a really great tool to be able to just alter our breathing. And in a few minutes, we can feel a lot more at ease.
Will it actually make the distension go away? What I'm learning from the experts on this summit is that bloat and distension are often used interchangeably, but they're not the same thing. And while bloat may be uncomfortable, distension is often very embarrassing for people because they're visually looking like they're pregnant.
Yeah. So that's a very good distinction. Bloating is a sensation of fullness, right? It's something that our brain is perceiving. Now, sometimes bloating can lead to distension. And distension is where there's a visible expansion of the girth of the abdomen, right? And we do oftentimes have women coming in saying, I have such severe distension that I look pregnant. And you're absolutely right. This can really impact someone's body image. This can impact someone's quality of life. Now, there is research that comes out of Spain. They've done quite a few studies on this extreme visible distension with diaphragmatic breathing as the treatment and practicing every day. Now, this distension came in response to post-ingestion, right, of meals. So what we think is happening is the brain is perceiving a sensation as a threat. So it could be the sensation of bloating, the sensation of fullness that someone feels after they eat. And that could be making the brain have a message to send down a signal for the diaphragm to contract. And what that does is when it contracts, the abdomen comes out. So in response to this uncomfortable feeling, people are tightening their abdominal muscles without realizing it. And so what the breathing does is it allows that pattern to be altered, and you expand the belly, right? You breathe from the diaphragm, you expand the belly on the inhale, and then you contract on the exhale. And so practicing this regularly diminished not only distension, but bloating in these patients.
Have you ever seen it actually go down with the breathing, or is it something that mostly they recommend to use prophylactically?
Well, I think it's important to do it both regardless, right? Because you have to train in it to be able to use it when you need it. But yes, I haven't had a patient in the office practice it and just watch it go down. But I do actually, anecdotally, there's patients that definitely say their bloating and distension is improved with this breathing when it's practiced. See, all these things have to be done and practice. That's how we get the benefit. We don't get the benefit about talking about them or, oh yeah, I did that once, right? Because what we're doing is we're training the body, we're training the mind with these practices. We're training our system to respond in a certain way. This is what athletes do, right? They train and they train and they train. So when they get out on the field, it's just natural. That's how they operate, is because they've been training. They don't have to think about it. It's instinct. So this is the same thing with the breathing. We practice it every day, and then we use it in response to stress. We use it in response to symptoms. We use it before and after we eat. So it's both things. It's a maintenance, and then it's used to help manage the symptoms.
It seems like it would be a good technique even if somebody didn't have GI symptoms, if it's going to decrease stress, because there's no cost, there's no side effects.
Well, the thing we know about this breathing is that when you practice it, because it's stimulating that vagus nerve, it actually increases vagal tone. And increased vagal tone is a sign of a resilient nervous system. And so when you practice it regularly, that's one of the things that it does. So does exercise, regular exercise, which is really important, increases vagal tone. Meditation and yoga can also do that. So anything that is helpful to bring that nervous system back to that parasympathetic, that balance, right, can help regulate the sympathetic, parasympathetic balance that we need. Because we're usually here. Right? We're in the sympathetic all the time in this fast-paced, overstimulated world. And especially if you're having physical symptoms that are uncomfortable, that definitely mounts that stress response and puts you in the sympathetic. So how can we regulate ourselves when we're feeling discomfort? This is a great tool for that.
I saw the video and I want to really try it. I practice yoga, but it's not something I do other than when I'm doing yoga. So this would be something to do, like, if I'm stuck in traffic or something like that.
Yeah. So one of the things that we all, right, have a hard time doing is establishing new habits, establishing new patterns. So what I recommend for people is, after you've practiced breathing, when you're actually connect and savor that feeling of ease, of what does that feel like in the body? And then you associate that feeling with the practice. And then when you make that association, then it's something that you want to engage in. It's not something that, I told you to do and it's checking off a box that you should do, right? Because we want to connect to what we're doing and be motivated to feel well. And, health is something that we often take for granted, but it's something that we need to engage in on a regular basis. Health is a way of being. It's a feeling, right? It's a feeling of feeling good. And we have to attend to that in our lives. But oftentimes what we do is we just, we do whatever, we eat whatever we want, we sit around, we watch TV, and then we get sick. And then we start paying attention to our health. And then when we start feeling better, we let those things go again. So if there's some way to connect feeling good with doing these things, right? And integrating them and making them part of our lives. Like, if you're going to exercise, find something you enjoy doing. Don't think of it about, I have to go exercise, right? And I think this is the way to really live a healthier lifestyle. And we know that lifestyle modifications improve GI symptoms. There's a lot of research that shows that.
I love that. Lifestyle modifications improve GI systems. And it seems, especially at UCLA, you look at it as like the whole health of the person, not just their tract.
Well, we're complex organisms, so to speak, right? So we're not just a physical being. Our mind contributes to our health. So whatever we're consuming with our mind, right? You watch TV all day long, especially right now. You're gonna be stimulated. You're gonna be in your sympathetic nervous system. And so what you choose to invest your time in and what you choose to consume with your mind is really important. And mindfulness meditation can help train the mind. Once again, we're training, right? To see, okay, what arises? What are our thought patterns? And And it's not about stopping our thoughts or ignoring our thoughts, but what it's about is really getting to know, what are our patterns? Where do we get stuck? What causes us stress? And that way we can learn how to respond differently. So we can see, I have this thought, like, let's say I have a GI symptom, okay? And then all of a sudden, oh no, right? And then you go back to all the memories you've had. And pretty soon it's not a sensation, it's a whole complex of things. So you have the sensation, then you think, oh, I'm not going to be able to go out because I'm going to have to go to the restroom, and I'm not going to be able to eat. So now I can't, I just might as well not even go. But what if you could just stay with that sensation and try to do some breathing, pay attention to just the sensation, notice the fear, the thoughts that you're having, but come back to what's actually happening and try to modulate that stress response. Because if you don't modulate that, it will increase. And then that whole negative feedback loop starts, right? You got the feeling, then there's the thought, oh no. Then there's emotions that come up. The brain sends a message back down, ramps up the physical feeling, you get more stressed out. So these are all tools to respond to our experience, to help us create more balance.
You know, you mentioned about sometimes people with certain GI symptoms, it impacts their ability to socialize. And people have all kinds of diseases of lifestyle, heart disease and diabetes, but GI diseases, some of them in particular, like IBS, they really do impact one's ability to socialize, because if you're afraid you're not going to be able to find a bathroom, you're not going to want to go somewhere, perhaps.
Yeah, so that brings up a couple points, right? If you think about it, what do we do for enjoyment? You know, just taking a moment for all the viewers, just to think about, what do we do for enjoyment? Many of those things involve eating and drinking, right? And for people who have GI issues, eating and drinking can trigger their symptoms. So yes, it's a big social component. So how can we learn to, have better health? So what we can do is, that's why we have dietitians. You meet with the dietitian. You look over what foods are triggering you. We know that certain foods tend to cause more certain symptoms, like certain kinds of foods might cause more diarrhea or constipation, right? So we can learn how to modify the diet in order to help those symptoms. But we also have to realize, when we're in a situation, how is the stress response contributing to that? And many times the stress comes from about thinking what might happen in the future. And so what we're doing is we're going and creating the worst case scenario, but then we're experiencing that in our body in the moment. So when we can see that for what it is, when we can see, oh, okay, my thoughts are taking me here, and you come back to what is actually happening. You come back, you feel your feet, you feel your body in the chair, you take a breath, and you come back to this moment, and you interrupt that negative thought pattern. And then you start over. It's like pressing a refresh button on the computer that's going like this. Because this is what, this is how we feel, right? When we have a stress response. It's a very kind of physical sensation that moves up and brings us into our mind. And then we get lost in the story. And the story of what could happen is actually what's driving the stress. So coming back to, okay, I'm okay, feeling your body, taking a breath, that can ramp down those symptoms.
And most people are not really connected to the moment. You know what I mean? That's what was so great about the class where I met you at UCLA. You want to talk a little bit about the mindfulness class? Because I was actually sent to the class by a GI doctor.
Yeah, so there's an 8-week course called Mindfulness-Based Stress Reduction, which really is the gold standard for research. And it's used to study a lot of different things. And we actually did a 3-year study with patients with irritable bowel syndrome. And we applied this class as our treatment. So it's an 8-week class, and people come once a week for 2 hours, right? Where we do education and talk about the stress response, talk about symptoms, talk about exactly kind of what we're talking about here, how you utilize this. And then we practice in the class. We practice meditation, the felt experience, because like I said, you don't get the benefits from meditation by talking about it, right? You have to practice it. And what meditation, what mindfulness does is it allows us to learn how to be with what is happening. Now, one of the definitions of stress is wanting it to be different than it is. And when we want it to be different than it is, can you feel that struggle? That, oh, I don't like this, I don't want this. So what mindfulness does is it opens us up to what is actually happening as it's happening. And then it helps us allow that experience, acknowledge that experience, and build awareness. And in that space of awareness is where we can see that we have a choice of how we're going to respond. Because we can't control what happens to us in our lives. But when we have awareness, we can intentionally choose how we're going to respond to what happens. And that's where the transformation takes place. And then we can apply this to our GI symptoms, which is what we did in the class. People start to see the connections between physical sensations, thoughts, and emotions, and how they all interrelate. And especially with abdominal pain, right? Pain is a complex of those three things. Pain is just it's not a physical sensation, right? And we know that the center in the brain that feels emotional and physical pain is the same. Centers are involved in that. And so we use this as a treatment. And what we saw is 70% of the people who were in the course had over a 50-point drop on a measure that's called the IBS symptom severity scale. So from beginning to end, we saw that they had decreased anxiety, increased overall well-being. And then we checked in with them 6 months later, and they still were having benefits. So this is lasting. But the thing, once again, that I have to stress is we have to practice that. And if we want to really think about it, we're always practicing something in our lives, right? Are we practicing being stressed? Are we practicing worrying? Yeah, a lot of us are, actually. And guess what? We get better at what we practice. And so we can also practice things like mindfulness meditation, gratitude, breathing, relaxation. And we should take time out to practice these things. So if you think about it as, I'm investing in myself. And this is what I want to get better at. I want to get better at feeling happy. I want to get better at feeling well. I want to have a healthy life. And the thing about our program is that I think that by offering people tools that they can practice on their own, it gives them a sense of empowerment and engagement in their own health. Because oftentimes when you go to a healthcare facility, you're putting your care in the hands of somebody else. And that's not a bad thing to do, because people are experts in their field. But for the patient and person who's having the symptoms to take part in their health and feeling like they have something they can do to manage their symptoms when they arise is very empowering. And we see that it actually helps. There's benefit from that, which is why we started the program. We studied the mindfulness meditation in our center, and I work in this research center, the Center for Neurobiology of Stress and Resilience, with Drs. Emran Meyer, Lynn Chang, and Kirsten Tillish, who are the gastroenterologists that also conduct the research. And we studied the mindfulness meditation. We've studied cognitive behavioral therapy. And we know that they have benefit to patients, which is one of the reasons why we're offering them in the clinic.
That's so cool. Did somebody have to be in Los Angeles to take part of this, or can some of this done be like maybe telemedicine, some of these classes?
Yes. So as when you're going to see a physician, it's important to have a physical evaluation. And so the gastroenterologist you would see in the office. Now, because of the state of things right now, many of the physicians, well, all the physicians are doing telemedicine as well. And so people have been referred to the program. Um, I conduct telemedicine visits, the dietitians do, the GI health psychologist does. So currently, yes, you can take part in the program. If you're a member, you have to be a member of UCLA Health or register through the system. And then once you see your gastroenterologist, you can ask to be referred to the program. And then we assess whether you're, eligible to be in the program, because we want to make sure that people are motivated and that are willing to practice, because this is a skills-based program. And like I said, in order to get the benefit, you have to practice things. And some people just might not be ready for it. But if you feel you're ready, absolutely. Check out our program, go to our website, and make an appointment with one of our gastroenterologists.
Yeah, we'll definitely provide a link from that. Suzanne, it seems like stress makes every disease process worse, but for people with sensitive guts, it seems, even more deleterious.
Yeah, as you said, so stress in general, right? We know that chronic stress causes inflammation in the body. We know that chronic stress actually can lead to a list of conditions that aren't GI related. But yes, so the brain gut bidirectional communication, which is now all over the media, which our research center has been studying. I think Dr. Meyer started the research center about 25 years ago. But it's great that people are embracing this idea, and it's very real. So when we feel stress, right, which is really kind of a demand on us where we don't feel we have the resources to meet that demand, we feel that in our gut. And even someone who doesn't have a GI condition, many people feel butterflies in their stomach. I felt a little bit of butterflies before we started this interview, because I'm not the most comfortable with speaking in public. So, and I don't have GI condition, but we feel it in our gut, right? So there's a very strong link between that. And when we have stress, that can cause an increase in our motility. It can cause things to move quicker. It can also cause things to move slower, which is what irritable bowel syndrome is. Irritable bowel syndrome is a chronic pain syndrome. People feel abdominal pain, and then when they have that pain, right, the brain sends a message to either slow down or speed up their colon. And then they either have constipation, they don't go as much, and that's uncomfortable, or they have the opposite, where now it's stimulated and they're having frequent stool and loose stool. And that has its own problems. So yes, that connection between the stress response and our gut is very strong. And this is actually where these tools are working, is on that dysregulation. We're helping to regulate that connection between the brain and the gut, because many people, especially people with IBS, have something called visceral hypersensitivity, right? Where the sensations that are going via the spinal cord to the brain is, it's like the sensation, the sensory part is heightened a little bit, and you feel more sensations in the body because the brain's not inhibiting as much. And that's where dysregulation, because imagine the more you're feeling, then you worry about that. Oh, what does this mean? What is that, right? And then that's what drives the stress response. And so we see actually that mindfulness meditation, in that study, we saw a decrease in visceral hypersensitivity as well. So it can help regulate. And same with the breathing. So let's say you're stressed out and because of your symptoms, right? You're worried about your symptoms and you start doing that breathing. You're sending a message to your brain that it's okay, right? And then you have something in the moment, and then maybe your brain doesn't perceive it as much of a threat because you know how to be with it. You have something to be with it. You have something to help you kind of come back to balance. It makes a world of difference. And you feel that in that moment. You feel better. You notice.
Yeah. The brain-gut connection, it's fascinating. I read Dr. Mayer's book, and I can't help but wondering, is there a brain, every other organ connection too? You know what I mean? Like it is just, or is it, but to the stomach, it just seems like you say so profound that we do, like when we're scared, even people without GI symptoms, oh, I have this sinking feeling. People often just feel things in their, I have a gut feeling, for example.
Yeah, well, the brain does really regulate many things in our body, not just our gut. All of our systems are connected, which I think is really important, right, to understand. So when you're taking care of your gut, you're actually taking care of your whole body. When you're exercising, right, that's good for your whole body, which is going to be good for your gut. When you get enough sleep. So these are things that people can really do to take care of their overall health. Get enough sleep, eat a healthy diet, exercise, connect socially with people, and do things you enjoy. Spend time doing things you enjoy, and those will increase your gut health. Because when you're off balance, right, that also makes our system off balance. It can cause dysbiosis in the bacteria. So, there's the brain gut microbiome connection, because our gut is also very closely linked to our immune system. So all of these things are interacting with each other all the time, which is another reason why diet is really important, because food is medicine. And we want to feed the good bacteria in our gut with certain foods. A plant-based diet, fiber is really important. But I think if people thought about health as a dynamic process, which it is, and that we need to attend to, and that we need to, kind of think about healthy living, and take that and live that way, then you're going to have less gut problems.
I know people with a variety of diseases like heart disease, diabetes, autoimmune disease, and while their symptoms may be very uncomfortable, they don't seem to suffer from the shame and embarrassment that people with certain GI conditions like IBS with diarrhea or distension have. Why is there so much shame and embarrassment with certain GI conditions? And how can we just make it, how can we make pooping okay?
Well, I think that's important too. When people come in to see us with GI conditions, is we have to normalize, and we have to create safety. We have to offer a setting where people can feel comfortable talking about their symptoms, because we can't really help people unless they feel comfortable telling us. And then they start to see the impact, right? They already know the impact it has on their lives, but our program can be really important in that way, because what you're pointing out is that it's not just a physical symptom. This physical symptom has impacts on somebody's lives. It causes embarrassment. It causes shame. That is in of itself stressful, right? So shame is being not feeling like you're part of the group, not feeling like you can engage in being a part of something. And so these modalities that we have can really help people begin to accept what's happening, right? We have to accept the way things are in order to get better. And I think once people realize that they're not alone, that there's many people out there who also have these symptoms, that helps a little bit, not feeling so shamed. But that's a really important point to make, because many people won't go to the doctor because of that. And so ask for help. You're not alone. This is very common. GI symptoms are so common. The thing is we don't know that because we don't talk about it, because we're ashamed to talk about it. And I'm not saying go out and tell your friends, but find practitioners that you do feel comfortable talking to and that can help you learn how to approach these things, how to approach the symptoms, how to approach so you can have increased quality of life. Because isn't that what this is all about? Is living a good life, is feeling well.
Absolutely. You used a word a couple of times that it seems like all the experts in GI health use, and that word is resilient. What exactly is resiliency? Why is it important in general, but especially for those that suffer with GI symptoms?
Well, okay. So the way I like to think about resiliency is imagining a tree. And there's a really strong trunk, right? And then there's the branches. And so that tree sits there. And then things come like wind, right? And the wind, think about wind as stress in life. The wind comes and the tree branches move, right? Sometimes they break off, but they tend to move with the wind. And to me, that's what resiliency is when hard times come, being able to acknowledge them and do what we can to learn how to be with and process and move through what that is. But in order to do that, we have to have that strong trunk. And that's why healthy behaviors can help, right? We want to build a strong immune system. We want to build a strong GI system. We want to have a good cardiovascular system. We want a good nervous system, mental. That's what the mindfulness can help with, the cognitive behavioral therapy. A healthy mind, a healthy body. So we can be resilient in the face of hard times. And stress resilience. So stress, it's not so much that stress is the problem, because if you're living a life, you're going to have stress. It's once again how you're responding and relating to the stress. And if you can move with it, right, you learn to surf those waves. That's what resiliency is. And many of these practices build resiliency. Diaphragmatic breathing builds a resilient nervous system because you're increasing your vagal tone. So resiliency also is about when you get off course, how quickly you can come back to balance. Because we all get off course. That's just natural, right, in life. So to feel like we shouldn't get off course or have bad times, those are kind of high expectations. We have to understand that everybody struggles in some way, and it's okay. But how do we get back? How do we get back to balance and come back? So resiliency really is about moving with and learning tools that can help you get through those hills in life, those winds that come.
Because it seems like a lot of times, at least people I know and myself included, like our GI symptoms started for a reason, but then they continue. That reason might be gone, but we, I'm trying to say, the symptoms just keep going and going and going, even though maybe the initial reason that created it is long gone.
Well, sometimes, and sometimes it's not. Sometimes we're not really aware of what's creating it. You know, like for instance, I saw a patient today who his stress in life is causing him to have some symptoms, some GI symptoms. Now, many people have the GI symptoms, and then the stress comes from the symptoms, and then it becomes the feedback loop. But it can go both ways. And so I think it's important to understand that they're both related, right? That this is a kind of a vicious cycle, that there's the symptoms and then the stress makes the symptoms worse, and on and on and on. But can you ask me the question again?
Yeah, what I was saying, like, for example, there's some people like maybe that had food poisoning, for example, and they got a GI diagnosis,
Oh.
and so that's no longer an issue, but the symptoms continue past the initial reason that caused it, and that it can be really distressing because you've dealt with the first thing, but now you're in this, like you say, like a vicious cycle of just GI. It's like you can't get out of it.
Okay, so you're talking about like a post-infectious, yeah, and there is post-infectious IBS. So some people maybe had some GI symptoms when they were younger, or maybe they didn't. And then they had a gastroenteritis, some sort of infection that caused, as we all know, if any of us have had that, a multitude of GI symptoms that are very uncomfortable. The infection passes, the symptoms don't go away. Yeah, so for some reason, either some genes were turned on, right, that caused these symptoms to continue. So if you have a predisposition, possibly to any GI symptoms in your family, that can make you predisposed that when you get an infection for that. And there's many reasons why, but the thing is that we still have to address the symptoms, because many people never had GI symptoms and now they have an infection, and yes,
Either way, they're uncomfortable, and it sounds like what you're teaching could help, because I love this idea of the vagal tone. I never heard that before, that because I never learned the diaphragmatic breathing, but the fact that that can actually do something physiological, I think is amazing.
yeah, and immediately it can really help us come back to balance. And like I say, that's what resilience is, coming back to balance. That's what GI health is coming back to balance. So what can we do to come back to balance? And I think the most important thing is that for the viewers is that there are things that you can do, that you can implement in your life that bring balance, that bring health. You know, we have to do things that maintain and sustain health. It's an ongoing, active process.
You mentioned a few times mindfulness meditation, and I know people that are willing to eat fairly healthfully and even exercise, but there's something about meditation, like, I can't do that. I don't have time. I can't just sit in a dark room for 20 minutes twice a day.
Well, first of all, you don't have to do it for 20 minutes twice a day, and you don't have to sit in a dark room. Those are all myths, right? So yeah, obviously the more you do it, the more benefit you're going to have. But being mindful is a quality that we all have when we decide to practice it, and that's coming into the moment. So you can have a little practice where you just remind yourself to come back into the moment. So just taking time, you don't even have to close your eyes. Feel your feet. Like do this right now. Feeling your feet, the contact, right? Where they're making contact with the surface. Feel the weight of your body in the chair. Feel your body receiving the inhale. And then feel your body letting go of the breath. And then voila, you're in your life, right? You're here in this moment. And by doing that, you unhooked yourself from anything that might have been keep pulling you in the future. And coming back to the moment is what meditation is about. So we sit and we anchor our attention on something like our breath. And then our mind takes us away, and then we come back. And then we notice, where does our mind go? And we start to see our patterns of mind. Like I said, where do we get stuck? We all have thought patterns that don't really serve us or help us, right? And when we can see them, that's when we say, oh, okay, this is what my mind does. But let me choose a different response. So we can practice mindfulness when we're doing the dishes, when we're taking a shower. It's a quality of being present with what is. Yes, sitting for doing that for 10 minutes a day is very helpful. And the research shows that you can have benefits just from 10 minutes a day. But the reason that we practice meditation is to build awareness and to build this quality of mindfulness to apply to our lives so we can be more present and engaged with our lives. So there's more and more research coming out about meditation and the benefits of it. And I think it's really been a very helpful tool for many people during this shelter-in-place quarantining.
Well, you have a very soothing voice. You should really make some meditation tapes, because when you were telling me to feel my body in the chair and my foot on the rug, I was like, oh, I was getting really relaxed. So,
well, the important thing to know is that you felt relaxed from how many minutes? Maybe it wasn't even that many minutes, right? So that we can do that for ourselves. We can come back into the moment. Yeah, it helps to listen to somebody guided in the beginning. But I do have meditation tapes, and I provide them for patients when they come in, and I also, direct them to other resources of other guided meditations and classes if that's something that they're interested in pursuing and practicing.
That's really cool. I didn't know that. You also mentioned hypnosis and gut-directed therapy. How do those help people with GI symptoms?
Well, so our GI health psychologist does gut-directed cognitive behavioral therapy and hypnosis. And so what hypnosis is kind of like putting you into a relaxed state, right? And then suggestion. So you would listen to a guided hypnosis that the GI health psychologist will provide for you. And then it brings you into a state of relaxation. And then the words that are coming in are like suggestions that kind of get into your, I guess, subconscious mind, so to speak. The cognitive behavioral therapy. So that's very similar to what I was talking about with mindfulness meditation. We start to see thought patterns that we have around things that aren't helpful. So if I'm feeling a little bit of, sensation, uncomfortable, abdominal pain, and I immediately go to, oh, well, I'm not going to be able to go to that party tonight. Is that a thought pattern that's helpful? So what we do is we reassess, is that really true? What's a thought I can replace that with? Now I'm simplifying this, but this is just how this works. And I think that you interviewed one of the GI health psychologists, and maybe she spoke more about that. But yeah, we offer those in our program through the GI health psychologist.
I just think it's cool that you have all these modalities so that people can try if what they're doing isn't really helping them, especially resolve their pain and their symptoms. When I took the mindfulness class with you, you told a story about a veteran. And I mean, I'll never forget that story. Like in life, if I'm ever in a situation where I find like I'm angry or making a judgment about another driver or person, I mean, that literally, it's been years now, and it's stuck with me forever. Do you know what I'm talking about?
I know exactly what you're talking about. Yeah. Yeah, I was told that story at a meditation retreat. And what this story really is about is that we don't know the whole picture, and we don't know what people are experiencing. And I mean, I can tell the story. I can kind of make it a brief story if you want me to.
Yeah, it's just I'm afraid I'm going to cry, but because you tell it so beautifully. But yes, please do, because
maybe I'll shorten it and not put so much feeling into it.
No, please do tell it the way you tell it, because I can never do it justice the way you tell it.
Well, so there was a vet who had come back, right, from being in war times, and was experiencing some post-traumatic stress disorder, PTSD, and was in a mindfulness class and was learning some of these techniques. And like I said, we have to practice them, and what better way to practice them is in our daily life. So he was also doing some exposure therapy, and that can also be part of cognitive behavioral therapy. And exposure therapy means that you put yourself in situations where you might not feel comfortable. Right? So your stress response is triggered a little bit, but enough for you to be able to handle it and use the tools that you've learned. So he decided he was going to go to the grocery store and pick up a few things, because he really, didn't feel comfortable being out in public that much, especially in places where crowds are, like grocery stores and things. So he went to the grocery store and he was picking up some items and he was doing okay, and he got into line, and he decided, because he only had a couple items, he was going to go in the quick check. And there were a couple people in front of him. And the person right in front of him was a woman holding a baby. And, he'd been in there for a while, and he was starting to feel kind of stress symptoms coming on in his body. And so he wanted to get out of the store, starting to feel that. And then the woman comes up, and she had a pack of gum, and she handed it to the cashier. And the cashier started engaging with her and talking to the baby. And then he's witnessing this, thinking, oh, I really, he started getting a little bit more agitated. And then the woman hands her baby to the cashier. And the cashier is like bouncing the baby. And he's thinking, okay, this is ridiculous. Like, what is going on? She comes into the store, buys a pack of gum, and now she's handing her baby and he's really starting to get more agitated. And so what he does is he does exactly what we were talking about, right? You come back into the body and you take some deep breaths to kind of modulate your nervous system. And then the cashier handed the baby back, and they went along their way, and he's like, okay. So he was at a place where he wasn't too angry. So he kind of said, oh, that's a cute baby. And the woman said, oh, you think so? She said, that's my baby. And my husband was killed in Iraq, and that's my mother. And my mother brings my baby in so I can see him twice a day. And thank you for thinking he was cute. And immediately, right, we feel that. We feel like, oh, okay, there's another side to the story. And we that's not what we normally think, right? We're in line. Why isn't this person hurrying up? And we feed into all these things that drive our stress response when we don't know what the real story is. And that's a really good point, because if we can open up to the whole perspective when we're having symptoms, and we get so caught up and lost in the pain and the stress response that we can't see, that we still have goodness and good things in our life. And that goodness becomes obscured by how much pain I'm in and the suffering and all that. But if we can keep our perspective more open, practice a little gratitude, What's good right now? Focusing on what's working, what's well, what's gratitude, what's the other side of the story. This is another wonderful tool for health, for balance. Yeah, so we don't always know. Can we have more compassion for ourselves and others? Yeah. And self-compassion is another tool that I offer, and there's a lot of research shows that that's actually an antidote to shame. So that's one of the things that can help people when they're feeling a lot of shame about their GI symptoms. But we're really just here, we're here as a team to support people who have GI issues. And how can we help people manage the symptoms? How can we help people enhance their health, build on the strengths that they're already doing, and just promote more well-being? That's what we're here for.
Yeah. Well, every time that I'm in a situation where somebody I feel is treating me either unkindly or unfairly, I go right back to that story and say, you know what? Just don't know. And sometimes I still get aggravated, but I thank you for that story, because it's always running in the back. So, a lot of people, Suzanne, that have GI symptoms have had them for a really long time. What would you say to somebody that, has almost given up hope that they could ever feel better?
Well, once again, trying to figure out what is the relationship they're having to their symptoms. So if it's hopeless, right? How can we try to restore some hope? Some people, they want, their idea of health and feeling better is to be rid of any kind of discomfort. And so what I think is really important is trying to help people move in the direction of health, to feel even, 10% better, and to honor that and feel that. And then that helps give hope. And then people engage again and are willing to try different things and more things that lead to better health. So first of all, the willingness, right? Because sometimes our expectations get in the way. Oh, I've tried that. That didn't work for me. Well, maybe it didn't work for you then, but maybe approaching it in a different way, it might work for you this time. And what does work for you mean? Because if work for you means ridding of all discomfort of life, well, that's not really possible, right? So let's start small. I always tell my patients, start small and be kind to yourself. Because, we beat up on ourselves. We think we shouldn't have symptoms. We think we shouldn't have discomfort. And just knowing that that's part of the human experience, right? And that we can get through this together. So we're here to support your health, but you have to participate and be a willing participant to do some of these things that lead to health.
Well, I hope people find their way to your class, because I know that their gut will be in very good hands. So, Suzanne, what is the truth about GI health?
Well, I think the truth about GI health is, I've said this already today, but health is a dynamic process. And taking care of yourself in any way that you can, by getting proper sleep, proper nutrition, exercise, staying connected to people that support and love you, loving yourself, caring for yourself. All of those things will lead you to better GI health. So don't be just focused on what is something I can take to rid of my symptoms, but open up to the larger perspective of what really is health. What does health mean to you? And how can you participate in behaviors that contribute to your health? And we're here to help you do that.
That's beautifully said. One of the other speakers said, good health results from healthful living. Thank you so much. I really enjoyed talking to you.
Yeah, and thank you, HA. It's been a pleasure.